Hi, my name is Dr. Ali Caliendo. I am the founder and executive director of an organization serving Nevada called Foster Kinship. We are a kinship navigator program providing support and resources to anyone who is parenting a relative or close family friend's child in the state of Nevada. I also study non-parental care, which means anytime a child can't be with one or both of their parents, and what happens to those children. And I look at what different states do in terms of their child welfare policy, how closely they follow federal law, and then the impact on the formation of non-parental care families, such as kinship families or traditional foster parents. So I'm here today to cover some basics about kinship care, with the caveat that every state and every jurisdiction does things a little bit differently. We all know that if we're in foster care for any minute. And not only that, but they're using words and phrases in different ways. So I will be very careful to define my usage of the vocabulary around kinship care. And I'm advocating that all of us, no matter what part of the United States are in, start using some same language when we're talking about kinship families, because it will clear up a lot of the confusion around kinship care. So I am going to share my screen so we can talk a little bit more. I'm going to show you a couple of diagrams as we get into this to hopefully clarify. And I also have some questions here that I know are important to some of you around kinship care, and I hope to address them as I go through this very briefly. So the first thing I want to talk about is just what is kinship care. So kinship care is anytime, the way I use this, anytime a child is with neither of their parents, but instead is in a household with either someone they are related to by blood, such as grandma, aunt, a cousin, even their older sibling, could be great aunt, could be uncle, great grandparents. So that's a blood relationship. It could also be somebody that they have a close relationship to or knows that either the child or the child's parents, and that's called fictive kin. When we see those arrangements, we're really talking about teachers, godparents, neighbors, or coaches, somebody that knows the child or the child's family prior to taking the child into their home. So kinship care is the group of people who are caring for children who are not with either parent, but are instead living with relatives or fictive kin. It's a huge number. It's so much bigger than the number that we understand children to be in our traditional foster care system or child welfare system. So when we're talking about kinship care, it gets really confusing. And this is why it's important to me to clarify what I mean by kinship care. So in the state of Nevada, there are approximately 38,000 children that we're going to have in this Venn diagram. Kids who can't live with either parent, but are living in households. So 38,000 children in non-parental care. The majority of them, which I'm going to go over in a second, are in kinship care. And as you can see, the majority of these children in kinship care are not in the foster care system. The intersection here of this Venn diagram would be those kinship families who are caring for a child who is in foster care. Now I'm going to show you in a second, it can be very confusing. Now it's confusing to us as professionals. It can also be very confusing to kinship families what their rights are in the foster care system. Some states require that a kinship family become licensed as a foster parent prior to taking a child in foster care. Some states allow kinship caregivers to become caregivers of children in foster care without being licensed as a traditional foster parent. They may have that option. So in this Venn diagram, you might see a state that says you can be licensed, but you don't have to be. So now there might be some licensed kinship families and some unlicensed kinship families. And then some states do what I call diversion. Many people talk about it differently, but basically they will identify a kinship family willing to take a child who would otherwise be in foster care and ask that they take custody of that child so that the child welfare agency does not take custody. So this child is not in the foster care system, but they're encouraging maybe grandma to go get guardianship or some other form of legal custody so that the child doesn't come into foster care at all. So you can see that this gets really messy in this intersection of this Venn diagram. Every jurisdiction does it differently, and every even different units in the same jurisdiction might have different informal policies or practices around how they're dealing with kinship families. So the most important thing for me as a kinship professional is to make sure our kinship families understand their rights, their responsibilities, what the options are caring for children both within and outside of the child welfare system. Over here, in this outside part that does not intersect with kinship care, these are our traditional foster parents, of which I was one. And as a traditional foster parent, you will most likely have gone through training and be prepared and receive financial payment the first time you take a child into your home. And traditional foster parents do not have a pre-existing relationship to the child that is coming into their home. They do not know that child's family. They do not know that child, right? That's a traditional foster parent. So that's how I use these terms. And then, of course, I've had a lot of confusion around our name of our organization, Foster Kinship, and we're really using the word in the non-child welfare definition, which is we encourage family connection. Now, why, as a foster parent and adoptive parent myself, am I so passionate about supporting kinship relationships? Number one, it is happening at such a large scale. Can you imagine if all of these kids needed to come into the foster care system? It would collapse immediately. So it is so important that we're supporting where kids already are. I care deeply about the outcomes for children who can't be with their parents. And the majority of them are with relatives or fictive kin. And I want to see those children thrive. I want to make sure that they have equal opportunity as children who come into traditional foster care, into a home like mine, which might have already had training and is financially prepared because we're getting some additional support to do that. The other thing is, research does show that on a number of variables that we can measure, children in kinship care actually have better outcomes than children in traditional foster care. Now, I want to be very careful here because when you really look at the research on this so far, there are a lot of holes in the data that we need to be careful about. For example, on some things that we measure, children in traditional foster care have better outcomes than children in kinship care. Also, it's really important to know that in terms of if we can actually break down unlicensed kinship foster care versus licensed kinship foster care, those are different outcomes. And you can intuitively imagine why, if a kinship family caring for a child in foster care has received the same training and financial support that a traditional foster parent will receive, they're going to have some advantages to those families that are doing the same work essentially without training and without payment. And so it's very important looking at the research to understand if they're studying kinship care versus traditional foster care, or if they're breaking it down by unlicensed kinship foster care, licensed kinship foster care versus this private kinship foster care, were kids diverted from the system or not. You can see where the research does get cloudy. And I'm happy to speak specifically about all the studies that I've looked at and the research that I do as well. However, overall, in general, children in kinship care on many variables, and some of the important ones, do better when they're able to stay with their family, with people who they know, who love them, and who are able to keep them connected to their culture, to their biological parents. There's several things that are really positive about kinship care that's very clear in the research. And one of the studies that always strikes me the most is children in kinship care are more likely to report that they always felt loved significantly over children in traditional foster care. So that is really important to me, and that is why I spend my entire life supporting children who are in kinship care. It's because we care deeply about kids. This is where they are. And I always bring up the question to foster parents who may not be fully on board with kinship care yet. If your family member came into the foster care system, wouldn't you want to be contacted and notified and given the opportunity to provide that care? I know that if my sister's children came into foster care, I absolutely am the right placement for those children. And I want to keep them connected to me, to my sister, to my parents, to our history. So just intuitively, I think, of course, we're all going to step up for our own family. And why shouldn't we be supporting those that are doing it at such a large scale for their family members too? So for me, kinship care is very important, and it really makes sure that the children who don't have any family and no one is able to step up for them, right? We're reserving our foster care homes for those children that truly, truly don't have anywhere else to go. A couple other things about kinship care to get a little academic here, and hopefully I don't lose too many of you, but there are questions that were asked about, can kinship care parents be licensed? What are the background checks? How does kinship care work? How does the child welfare system get involved? And so it's really important that when you remember that most children are in kinship care without the involvement of the child welfare system, then we have those diverted families, and then we have sort of a mix of child welfare involved kinship families. It's important to understand how these families are different and how to meet the needs of these different kinship families depending on sort of how they were formed. So this is a flow chart. When you think about that big circle on the previous slide, children who cannot live with their parents and kinship family have stepped in privately. Right? This is our private kinship care family. There's never been any child welfare involvement. For these families, there's no option to become a licensed kinship caregiver. They are really going to be looking for resources outside the child welfare system. The child welfare system is not involved. And so those resources and supports that come hand in hand with foster care are not available to, now you know, the majority of kinship families. But there are other ways that kinship families are formed, and this is where it gets a little messy. So let's say the child comes to the attention of the child welfare system and a decision is made. For whatever reason, that child cannot remain safely at home with either of their parents. The child welfare system needs to decide if they're able to place with kin, and federal law mandates that they're looking for kinship families first. So if they're able to place with kin, then the next question is, are they going to maintain custody of that child? So when I talk about the diversion, I'm talking about the child welfare system has identified a kin, but decides that that kinship family is best suited to get custody, and custody is not held with the child welfare agency. So in that case, we call it diversion, we can call it voluntary kinship care. They join those families in this big circle, right? So these families, even though they're formed kind of by the child welfare agency, they are operating outside the child welfare agency once they get custody, and they don't have the supports of the child welfare system either. So these two types of kinship families end up being the majority of that big kinship circle, and they're the ones that are not in public child welfare. We can call them informal kinship care. You're going to hear a lot of different ways that these families are described. So I'm listing many of them so that maybe this picture starts coming more clear. So now we'll go back up to this decision triangle. Let's say the child welfare agency wants to place with kin, and in fact, they're going to maintain custody of that child. Now we're talking about if the kinship caregiver is able to be licensed. Depending on the state and jurisdiction, it's going to look different. In many states, they have the option to remain unlicensed. And so now we have unlicensed kinship foster care. These families are caring for children in foster care. They are not necessarily trained. They are not necessarily receiving any reimbursement. However, most likely there's been a background check and a safety check of their home. And caseworkers are still following their policy about every 30 days. They're meeting with that child in that child's home. So there are some safety oversights, and there are certainly supports for the child who is in foster care, including reunification support for their parents. And many states, they are required to become licensed in order to take that child in foster care. Or like in Nevada, they might have the option to become licensed as a kinship foster parent. So again, we're still looking at kinship foster care, but now these licensed homes, they have undergone not just the safety check and the background check, they've undergone the training that traditional foster parents receive, and they've undergone, they receive payment, right? Which is, as a foster parent, I can't do this work for free. These kids are expensive. Even in the most well-resourced home, we would not expect to do this work completely out of the goodness of our hearts, because we would put the rest of our livelihood at risk. And so I love licensed kinship foster care. I think this is an amazing compromise. We're able to give families support. We're able to give them financial support and training. These children have oversight. Their parents have a path to reunification, should that be appropriate. And research shows that when they've done some studies on looking at traditional foster care versus licensed kinship foster care and unlicensed kinship foster care, kinship foster care that is licensed is the most safe and stable placement for a child in foster care. All right, now back to the decision triangle. So these two guys in the red type here in this blue, they are by inside of the Venn diagram. These are these two people, okay? So this could be split in half if we wanted to get confusing. And then if we go back, right, we're going to talk about how traditional foster care happens. You know, a child is removed, there is no family identified, and then they are placed in traditional foster care. And thank goodness for traditional foster parents who do the work to protect children who really have nowhere else to go. Now, as a traditional foster parent, you were probably taught in training that you are not only working with the child's birth parents, but the child welfare agency is doing their diligence to find family members for that child. And so oftentimes within the first 12 months of a foster care placement, traditional foster care, a grandma might be found maybe in another state, and they're going to do maybe an ICPC to get that child to family members. This is, again, required of a child welfare agency. It's the right thing for kids. It's federal law. And for the most part, it's really good to keep children connected to their biological family. So as a foster parent facilitating those relationships, you are doing a really amazing service to helping a family heal and helping kids remain connected to where they come from. So that's my academic overview of kinship care and a lot of kinship terms. I just want to give an example of what this looks like with a different type of diagram. In the city where I work, Las Vegas, we're in Clark County, Nevada, and this is data as of March of 2020. This is just another way to view just the enormous impact of our private kinship care, right? This is that big circle without the intersection of foster care. 5% of all children in our area are in non-parental care, so they're not living with either of their parents. And the majority of these kids are in kinship care outside of the child welfare system. This ends up being, for Clark County, about 24,000 children. And then here's that intersection of the Venn diagram, that's kinship foster care. That's another 5% of this. And then we have our traditional foster care and then other placement types, which could be group homes or institutional settings. So again, kinship care is just the majority home for any child who can't be with their parents. Now, if we're going to break out this section here to see what does this really look like in the foster care system, in Clark County, these are actual head count numbers as of March of 2020, about 12,036 kids. Oh, yeah, 1,236 kids in kinship care. So, but some of these are licensed, some of these are unlicensed. Those numbers are harder to arrive at. And then over here, we have our traditional foster parents. Thank them for their work. Therapeutic foster care, voluntary jurisdiction, and other. And then we have a group of kids in parental care too. So when you look at it, we're looking at kinship care caregivers in our area and in many of your states caring for a plurality of children in foster care. In our state, it's 40% of children in the foster care system are living in kinship care. But again, never forget that outside that system, we have this whole other safety net of kinship caregivers who are providing incredible care for children. So why does an organization like Foster Kinship have to exist? The reason that we exist is because we know that kinship caregivers are more likely to be older, more likely to be living on a fixed income, more likely to be single females who are heading up their household. They're less likely to receive training and payment that foster parents receive. They're less likely to have any child welfare oversight of what's going on, which means no reunification services. No one's checking on the children. So even though kinship caregivers are doing an incredible job to make sure that children are not in the foster care system, there's still a lot that we can do to help these families. And that is what an organization like Foster Kinship focuses on, is making sure that our kinship families are safe, are stable, and are able to provide nurturing care to children who've experienced abuse, neglect, and trauma. This is not something that just you automatically know how to do because you're a relative or a fictive kin. It's something that we work really hard with our families to be able to provide. So at Foster Kinship, we serve our entire state. In 2019, we served about 1,700 kinship families. And since we've opened our doors, we've served over 10,000 children in kinship care. And we do this through our case management model, which ensures that children are in the safest home possible. And then we are working to stabilize that home through financial support and legal stability. And then we do a lot of things to train kinship families to work with children who've experienced trauma, abuse, and neglect. We also provide a lot of access to support because kinship caregivers really need to be around individuals who are doing the same work and who understand. You're not just dealing with a child who's got additional issues. You're dealing with your own family members who are also working on healing or not, depending on where they are in their own journey. And it can be extremely difficult to be balancing the needs of your family, the parents, and the grandchildren or the relative, the relationship to you. It's hard. It's super hard. And so providing emotional support through support groups, in addition to training to make sure families have peer support, is a really critical part of supporting kinship caregivers. So I want to make sure that I've answered all the questions that have come through. So in terms of what assistance do most relative caregivers need in raising children, no matter what state you're in, caregivers are going to need access to financial support and legal help. Those are really basic. They also may need assistance with things like basic needs, diapers, wipes, car seats, cribs. When they first get a child, prior to being able to access any ongoing financial support, they might need to be able to meet those basic needs. Connecting to community referrals like early intervention services or support through the school district, those things are critical. And then just the basics. Does the child have health insurance? You know, are they able to take the child to the doctor and enroll them in school? These are things that if there is a navigator program in your area, that program is probably an expert at helping families connect to those resources. Not every jurisdiction has a navigator program. A great place to check is go to grandfamilies.org, and there's a list of current navigator programs there. Generations United also is a good resource, and for every state they put out something called Grand Facts, and that will help you find locations of support in your area. And if you can't find anything in your area, you can always reach out to me at Foster Kinship, because again, my academic work is really looking at what states are doing, and I'm happy to connect you with any area program that I'm aware of that might be a little bit hard to find. In terms of permanency for children in kinship care, we're looking at very much the same options if the child is in foster care as a traditional foster parent placement. So the same federal timelines exist, and children, if they cannot be reunified, are going to be either adopted by their relative. Relatives have another option in most states, and it's called KinGAP. KinGAP is a subsidized guardianship that's available to kinship families caring for children in foster care, and they're able to receive some financial subsidies similar to the adoption subsidy until that child is 18. Research found that kinship families who are caring for children in foster care were less likely to adopt their relatives, meaning children were waiting on permanency in foster care. And this is because they were a little more hesitant to take those rights away from maybe their son or daughter or change their relationship legally. KinGAP is a great solution for that because it allows the same support as adoption, but it doesn't require that the biological parent's rights are terminated, and it allows that guardianship relationship to be the permanent outcome for the child in foster care. Outside the child welfare system, there are not support for reunification with these kinship families. So it's really up to the kinship family to decide if and when parents are ready to have their children back. That can be a really difficult thing to work with a family on. And they really do need some support professionally, if that's available, to make those decisions. But you're going to see that families have a range of options in outside the child welfare system, anything from just physically having the children living with them, maybe for years, maybe a temporary guardianship, maybe a piece of paper that's just been notarized, maybe a legal guardianship or some other form of legal custody. There's a range of options outside the child welfare system, up and including to private termination of parental rights and private adoption outside the foster care system. That can be quite expensive. In our state, I really encourage any family who's seeking to do a private adoption or any arrangement to reach out to us, because we can help them usually file these documents without the cost of a lawyer if it is relatively straightforward, and save just an incredible amount of money. In terms of why is a child in kinship care and when should a non-relative placement or adoption be considered, as with everything else, we have to have a child first viewpoint. So best interest of the child, which is often lost in child welfare, unfortunately, is really important. Kinship care being included. Kinship care is not a panacea to all of our issues that we have in child welfare. And unfortunately, not every kinship placement is able to provide the adequate level of safe care for a child. So if a child is not safe in kinship care, and there is no other family, then absolutely a non-relative or adoptive placement is the appropriate place for that child. So it is case by case, right? So one of the big pieces of work in kinship care has been for us to get away from the idea that the apple doesn't fall far from the tree in kinship care, right? So, well, mom couldn't handle it, so why do we think her mom's gonna be any better? And so we work really hard to get away from that myth, because it is absolutely a myth. If you look at your own family tree, I'm assuming that a lot of you have addiction and other issues in your family that you might be raised the same way as your siblings and have gone different ways. That's in every family. So we can't be just assuming that because family is related to someone who's struggling, that everyone in that family tree is unhealthy. That's absolutely not the case. But there are times when there is not suitable family for a child, and that's when our non-relative traditional foster parents, traditional adoptive parents are great options to keep children safe. I will never disparage the work of traditional foster and adoptive parents, because this is also something I'm passionate about in my personal life. Finally, there's a question: a baby born with half siblings in foster care, are siblings considered kinship? So this gets tricky. So let's say that I am a traditional foster parent and I have adopted a child, and then that child's mom has another sibling, right? Another baby. Well, actually, this happens all the time, right? A lot of us foster parents keep beds open for this specific reason. So in many child welfare jurisdictions, they will seek out the caregiver of the child's sibling, because siblings should be placed together. And so depending on if there is another family member for that new baby, that's where it gets confusing. So if it's a different dad and paternal grandma is right on top of it and wants to take that child, we're now balancing the rights of siblings to be together and to know each other with the rights of kinship families to keep children in their home. So I have absolutely seen this go both ways. I have seen decisions made where the child is placed with siblings, and I have seen decisions made where the child is placed with their relative with open visitation with siblings. And I have seen decisions made where a child is placed with relative or a non-offending father and there is no sibling visitation. So this, again, is case by case depending on the area that you're in. You are technically not a kinship caregiver if you are trying to get a sibling of a child you've adopted through traditional foster care. However, in some jurisdictions, you might be considered kinship for the purposes of reopening your license if you can reopen it faster under the kinship than traditional foster parent. So it's a great question. It's a complex question. There's no black and white answer. And I've seen it go both ways. Okay, I do believe that I've answered the questions that were sent to me. I have given you probably too much information on the different types of kinship care, But hopefully this is leaving you with what kinship families need, why kinship care is important, and how you can step up to support children in kinship care. If you have questions, I am happy to be reached anytime. My name is Ali Caliendo, and you can just reach me at Ali, A-L-I, at fosterkinship.org. And I wish you all the very best in your journeys, and have a wonderful day.